Hi, my name is Alexis Oliver. My ID number is 298-1022. Alright, so one very, very important useful thing that we need for radiographs is our dosimetry badge. This is our thyroid pad, and then we're going to place the dosimetry badge right over it. And this is going to help us manage the amount of scatter radiation we're retrieving through our system. So the dosimetry badge, how it works is there's a little plate inside of this, and this is going to measure not the direct radiation we're getting or the patient is getting, but the scatter that is emitting from the machine afterwards. And how we can check those, our manager has an account set up to where we get reports, and we get quarterly reports every 3 months, and that will tell us about our different our levels. There's level 1, level 2, and level 3 for radiation that you're allowed to have, and it also lets us shows all the staff and how much we're getting. It goes from deep to eye to shallow, and then our total annual. So let's take a look. So here we have a report at our clinic. So with 2 pages worth of staff. So if you look at this bottom page, this is going to be our threshold levels. So we have level 1, level 2, level 3. We like to stay in between level 1 and level 2, but it is awesome. It takes a lot to even get past level 1. So I'm going to look at mine. I've been here for 3 years. Let's see. So far my threshold is only 74. So that's awesome. So, and that has even met the annual threshold we have for DDAT all. So if we look at April, who has been here for 12 plus years, you find April all the way over, and she's at 349, and she still isn't even at the threshold. She's not even near it. So that is how we look at the dosimetry. We print this out every year, and we keep it in our radiology log. So how we're looking for damaged PPE, we take a look at our lead barriers. So we have our thyroid. What we're looking for is any tears or anything that could be emitting past the lead in here. So we expect them every time that we use them, just because cats and dogs can definitely be an issue. A main thing is you definitely never want to fold them, especially the aprons. So we have an apron here. Let me see if I can transfer this over. This is our apron. It is lead based, and we always look at it every time we are about to wear it, just to look for any tears or rips. You can definitely see there are scratches on it from definitely our patients. You see it's on this rack here. Is we never want to fold these guys, because that can do some major damage to it, and that's gonna put a default in the apron. Hi, my name is Alexis. I'm gonna go over the proper PPE for radiographs. On my neck I have our thyroid protection, and then on my body I have my dosimetry badge. That's going to show the proper amount of radiation I've been exposed to taking x-rays. I have my lead shield, and then another PPE that we always use is lead gloves, and we use the lead gloves when we're restraining to pull out the legs, front or bottom, and then we can also use it in case that we need to hold a certain way. We can also block our hands or whatever we're using to protect us from radiation. And other ways to help with different restraint techniques, we have muzzles. We have cat muzzles and dog muzzles. Cats can definitely be a little bit tricky, especially when you're trying to do a chest view of a cat on its back, because you're needing to extend the neck forward and the arms, and sometimes they can be a little bit challenging. So if you do not have a cat muzzle, which we do have, you can also use a towel. We place over the head to kind of make them relaxed, and then sometimes you always cannot restrain their scruff, because that's going to mess up the view of the shot. I apologize, but in one of the videos for the positioning, I did use a towel on a little cat, and then I also will place my hand safely underneath her jaw, and I will extend her head up with my other hand, and I place the towel first on her head so she doesn't see anything, and then I wear gloves on top of everything. So I'm safe, she's not going to bite me, she's more calm, and that definitely helped out. And then with dogs, depending on what we're shooting, you have 1 to 2 people. Muzzles help as well. How certain ways we would help if they're kind of a little nervous and we're doing especially abdominal works, but not necessarily on chest is you can use your forearm to kind of lay across their neck, kind of calm them down a little bit. You still want to protect yourself against from any of the beam. You do not want to be in part of the beam at all, but it's going to help in the long run because you're going to help make that dog stay still and kind of help them out. Alright, so there are a few protective barriers that can be utilized during when we're taking radiographs. We have the trough, which is the V-shaped kind of padding that we use for patients that are getting lying on their back for either hips, chest, or abdomen, or even skull. That can help, instead of a person holding them and keeping them straight, we have the trough that can help hold up the animal as well, so it's less exposure for the technician. We also use either slip leashes or gauze to help restrain the legs. So if they're asleep, we definitely use that, and if they're awake, we can use it to extend out the extremities, like the radius and ulna, or even the stifles and stuff like that, because the less we are exposed to, the better, because the radiation that we are using is ionizing radiation, which is a cell damaging type of radiation. But the amount that we need to be exposed to is definitely really high, which is why we have the dosimetry badges to keep track of that. But the less we are exposed to, the better, and that's why we use the PPE and definitely other instruments to help us. With that, we have several people that cannot participate in x-rays, like pregnant women or any person under 18, and the reason why is that they are still developing. And with this type of radiation and our bodies, we're 80% water. And with our DNA, the radiation will affect us and affect our DNA and our cells to even cause cancer and hurt our cells. And with a pregnant woman, they are carrying a child which is still developing. And if you're under 18, you are still developing as yourself, and it can hurt in growth, it can hurt in cells and stuff like that. And especially if you are not a trained person to be using radiographs, we want you out of the room, even out of kind of the area we are even doing radiographs, because of scatter radiation. Every client or every patient, every employee that works here has their own dosimetry badge for that reason. So anytime they're in the radiology suite, it goes on them, because even with the radio, if you're not taking radiographs and the machine's on, it's still emitting radiation. And we have several controls set up to see what's scattering and what is not, what is staying in here, which is definitely safety. And we want to make sure with the patient as well, we want to get the shot correct on the first try, is because we want to use less radiation as possible, because sometimes if they're moving, unfortunately, it can take up to 4 or 5 tries, and that is a lot of tries trying to get the patient still. And you never want to put a person through that, or the animal through that, because it is damaging and it can do some harm. And the other reason why we don't recommend like holding the animal unless it's an emergency, like during a a pen hip, we don't use a chop because that can affect the outcome of the thing. We have a person kind of holding the body, but that body is shielded, and the thing is that person is still not near the beam at all, because if you are under the beam, that is direct ionizing radiation, and that is definitely not good. So we take all the precautions and here very seriously. Alright, so one of the videos I will show you is how we will restrain for certain views. We typically restrain for when we're either sedated or for certain limb views. So when we have, let's see, you will see that I'm doing a cranial extension of the radius and ulna. You will see on the cat that we wrapped her carpus with gauze, so that indicates that we are going to be stretching out her legs, so we can get that full shot of the radius, ulna, and even her carpus. And the fact that neither of the technician's hands will be in that shot, or even gloves, is perfect, and we're able to fully extend and not hurt the cat, and she will take it better. And so we also have our troughs that we use. We have a small one and a large one. This is for our VD views, and certain other ones, like we do hips, chest, abdomen, all ventral, dorsal views. We unfortunately do not have any sandbags that we typically use. Unfortunately, we don't have any here. But we also, if we need to kind of hold a leg a certain way, we also use a wooden spoon, which unfortunately I can't find because we used it earlier. We can use a wooden spoon or anything kind of radio opaque that will not show up. And also we've used even styrofoam for when we do exotic radiographs. So how we do certain ones is, yes, you can get a regular DV using the radiograph, but when we're trying to do a lateral or a rostral view, we stack them on cans because we're able to flip our machine horizontal, so it's able to get the nice view with it. So we'll stack cans up, and of course those will definitely show up on radiographs, and if the turtle's right on it, it's going to be kind of confusing to differentiate to see if something's actually in the turtle or not. So we use those thick styrofoam to separate the fact that the cans are from the turtle, and we're able to see what's exactly in the turtle versus just looking at the cans. So those are some of our things we use to help with radiographs. Alright, for this next video, we're gonna, Hiccup and I are going to demonstrate how to measure and perform a lateral viewing of our tibia and fibula. So where you measure that at is, you're going to measure at the distal end of the femur. So we have his femur, we have his patella and stifle. As soon as we get that measurement, we're going to put that into our chart, and that will give us the perfect measurement for that. And then he's going to lay down. Come here. Come here, turn around. Turn around. Come on, continue. All right, sit. Down. All the way. Good boy. All right, so we're going to move the crosshairs over and extend it so we get the full places that we need. So his right leg, his right side is down again, and that's the leg I'm getting for is the right leg. So I'm going to place the right marker right next to his right leg. Simple as that. And typically they can be sedated for this, but they don't always have to be. Hiccup, in his case, he is very, very good. In some instances, you can use a slip leash or gauze to fully extend that leg back. But I'm perfectly comfortable doing it myself. Pick up. Stop. Give me it. Give me it. So I'm pulling that leg down. So the crosshairs is going to be right on top of the tibia and fibula. And I'm pulling the left leg out. So I'm not going to get that in the shot. And my gloves are covering just right before the hop. But it's perfectly fine picture right there. So we have the crosshairs going over, and he did great. Alright, so in this video I'll be demonstrating how to perform and get a cranial caudal version of the radius and ulna. So Emmeline is tying gauze, non-stretch gauze, to her feet, so we're better able to extend the legs out for a better view of both limbs. Alright, and where we measure is, you're going to measure at the distal end of the humerus. So after she is done attaching the gauze, we will measure real quick. And of course she wants love in the meantime. I like having two people for this position, one to hold the body and the head up, and the other person to extend out the legs with the gauze. So depending on what side she's facing, her head is toward the north. So we have our left and our right indicator. I'm going to place, typically when we're using, if it's an affected leg, I always like to put the indicator at that leg so we know that's the one we're absolutely looking at. But in this case, I'm going to be placing the left indicator on her outer part of her left leg instead of the middle, because sometimes that can definitely get confusing whether what is the true left. So I'm going to put it on the outside of her. So I'm going to measure her leg. You extend her leg up, just one of the legs up. Alright. Good girl. Good job. This is so good. So good. Good job, baby. Alright, so I have her measurement, and we're going to go look over at the pre-measured sheet we have, and then we'll plug it into our x-ray machine, and then we're going to focus. We would move this x-ray over. It would have the crosshairs focused in on her radius and ulna only. So we're going to close this in. So how we typically do this, I'll have to remove the towel, unfortunately. Perfect. So keep the light on. Sometimes it's best to turn off the light, especially if they're a darker cat, because it's hard to see. Of course, she wants booty love. All right, so I'm going to extend her neck upwards while Emmeline pulls her feet forward. So we want the legs flat as possible when it comes to this view. I know, baby girl. You're doing great. You're doing great. So her crosshairs are going right between her radius and ulna, and how you keep the neck extended up. You can definitely see that my hands can be in it, but we have gloves. We can get a glove. You're doing so good. I don't think she is. I know. And I would
You're doing so good, baby. I'm so proud.
use this glove above her head and to block the view of my hand getting in the way to emit any unnecessary radiation. So she did great for that demonstration. She wants that off. So we'll just do another view in a second. All right, in this video, Hank and I are going to demonstrate how to measure and show how to hold for hip x-rays. So typically they can be definitely either anesthetized or sedated, depending on what views you're looking for. We can do pin hip, and we can also do OFA, and we can also do hips as well if sometimes they just need x-rays right away. So you're going to measure the thickest part of the pelvis. Good boy. Since we're doing VD, we're doing this view. Come here, baby, move forward. All right, we'll get that plugged in. We'll get them into the trough because that is the only other thing we need. And we'll see you back just in a second. Okay. Okay. Good boy. All right, so we have Hiccup in the trough. He did perfectly fine. So I'm gonna go over here near his hips. Yes, someone can be at the front loving on him, but as